Illinois service delivery. The Illinois service delivery system is one that is very challenging for our families and for people who are trying to make their way through to achieve the goals that they want to have in their life. So tonight, really, our focus is on giving you some tips and tools on where to start and on how to navigate the service delivery system. And we have a great panel tonight of presenters that come from a variety of backgrounds and have a pool of talent and expertise. So I'm really excited to let you know tonight that Rebecca Curran and Leslie Hart from Service Inc. is with us, as well as Mike Pesola from the Division of Rehabilitation Services and Alexandra Baig from Clancy and Associates. So I'm going to take just a moment to share with you a bit about our 4 presenters that we have this evening. Rebecca with Service Inc. Is the Pass, Puns, and Bogard Program Manager for the organization, and she serves the Illinois Region E area. I'm sure she'll tell us all a little bit more about what that means. Rebecca graduated from Benedictine University with the Bachelor's of Arts in Special Education. She's worked with individuals with developmental disabilities for 24 years, and the last 21 years she has been in service coordination. So obviously a great deal of expertise and information. Leslie is the Assistant Program Manager for Pass, Puns, and the Bogard Program for Service Inc. And she's also in this Region E area. Leslie is a graduate of Knox College. She has her Bachelor's of Arts degree in Sociology and Anthropology. She's also worked with individuals with developmental disabilities for 25 years and 21 years in service coordination. So I am thrilled that we have a total of 42 years of service coordination, so experts in helping families, walk through this service delivery system. So I'm sure that those 2 ladies are going to be very, very helpful to you tonight. A bit about Mike. Mike grew up in Hillside, a graduate from Immaculate Conception High School in Elmhurst, and attended Bradley University and was studying communications. When in his senior year in 1992, Mike suffered a brain aneurysm that left him paralyzed on his left side. After months of rehabilitation, he regained his strength and his ability to walk with a leg brace and was able to return to Bradley, got his bachelor's degree in public relations, and then went to work with his parents in Oak Brook, in a deli, and worked his way through graduate school, while also working as an employment specialist at Spectrum Little Friends in Downers Grove, but spent his weekends working on his master's degree in rehabilitation counseling through the U of I, and achieved that degree in the year 2000, and has been working as a vocational rehabilitation counselor for the Division of Rehabilitation Services since 2001. So again, a great deal of experience, 20 years of experience working in vocational rehab, specializing in supporting individuals with disabilities to find jobs. Mike's a real asset to the field, and I know we'll have a lot of great information to share as well. Alexandra Baig, she maintains her own national financial planning practice called Companions on Your Journey, and also acts as the benefits specialist for Clancy and Associates. Clancy and Associates is a law firm that focuses on special needs planning. She's also an adjunct professor for Elmhurst University's program for youth with disabilities. I believe it's called the ELSA program. Alex also has an MBA from the University of Michigan, and she's a certified financial planner as well, and a member of the Academy of Special Needs Planners. Again, I mean, a professional that's coming to us tonight that has a great deal of experience in the special needs planning area, which is something that I don't know that as a field we spend enough time talking about. So very much so looking forward to the resources and information that she's going to share with you about how to maximize public and private money so that the people that we all care about can live the life that they choose. So without further ado, I want to turn it over to our presenters this evening.
Well, thank you very much, Kim, for that introduction and for having us here this evening. I am Rebecca Curran, and with me is Leslie Hart. Like Kim said, the Illinois service delivery system is a challenging one. I'm hoping that after this, it'll be a little less challenging. So who we are, let's see if I can get this going here. Who we are, what we do. So we are, Service Inc. of Illinois, our Region E, we are the Independent Service Coordination Agency for DuPage, Kane, and Kendall County. Primary functions, we enroll individuals on the PUNS database, which is the state of Illinois' waiting list for Medicaid waiver services. We complete pre-admission screenings of eligibility for Medicaid waiver funded services, skilled nursing care facilities, and intermediate care facilities. We link individuals to service providers, apply for Medicaid waiver funded services, provide ongoing advocacy and oversight of service delivery once someone is in Medicaid waiver funded services. And then a large part of what we do is sharing community resources. So kind of where to start. I think I'm hoping everyone knows that about PUNS. It is one of two ways to obtain waiver funded services in the state. So PUNS in and of itself, like I said, is the statewide waiting list for children and adults with intellectual or developmental disabilities who want or need disability services but don't yet have funding. As funding is made available, the Division of Developmental Disabilities will select individuals from the PUNS waiting list. I should backtrack and say from the seeking services category in the PUNS waiting list. An individual's wait time on PUNS begins once they are 18 and are in the seeking services category. Time doesn't accumulate when someone is in the planning for services category or prior to the age of 18. Selections are now being made based on someone's length of time as an adult, so age 18 or over, in the seeking services category, basically meaning those who have been on the list longest in the seeking services category will be selected first. Selections are not being made for the planning for services category, and selections are not currently being made for children. Right now, the goal for the division is by fiscal year 2025, no adult will wait longer than 60 months on PUNS. But Director Stark did share that as of the recent PUNS selection that occurred in July 2021, no one waited longer than 57 months. So they're actually ahead of their goal. So PUNS, in and of itself, there's two categories of need, the seeking services category and planning. Seeking services would be for individuals who are currently in need or want services, and then planning for those who don't currently want or need supports or services, but may in the future. There is a misconception that you can you can automatically move from one category to another. It is not automatic. We actually need to hear from an individual or family that they have a desire to move from one category to another. So enrollments and updates. Initial enrollments, we do an intake over the phone. We gather identifying information, including individual social security numbers. Once an intake is completed, they're assigned to work with a service coordinator. Prior to COVID, all initial enrollments were required to be done face-to-face. Since COVID, they've been done virtually. PUNS updates are updated annually or sooner if the circumstances warrant. Those can be done over the phone, in person, whatever is easiest for the individual or their family.
Can I just jump in real quick?
Yep.
To supplement what she was talking about, when we're talking about wait time on PUNS, and only adults are selected, sometimes we get questions about what's the benefit then of a child being on PUNS if they're not accumulating wait time or they're not being selected. So there's three different reasons. First would be providing the division data. Who's out there? What are they looking for? What are the numbers coming up as people are getting older? What can the division expect the needs will be over the years? The other is if the division ever changes the way they select individuals, if they ever go back to opening it up to children, it's better to be on the list than not on the list. And then the third reason is the division has asked us to have very pointed conversations with families when someone is age 17. We're talking about the need to get into that seeking services category if the intention is that they're going to need services when they're exiting school. So we have that pointed conversation. We make recommendations to move into the seeking services category if they're not already, so that when they turn 18, they're automatically starting that wait time, that accumulation of time. The other thing I wanted to mention real quick was a nice thing that the division has put into place is for those individuals that will be selected 6 months prior to that time, they're going to be getting a letter from the division that says, hey, you know, in this next fiscal year, we anticipate selecting you from the PUNS wait list. And that 6 months, I should say, as long as there's funding available, essentially is what the letter says. And that 6 months of time that's allotted gives the family time to decide, what do they want? Do they want services? Do they have maybe Doors Home Services right now and they rather stick with that rather than moving into DD services right now? Do they need to start gathering documentation of disability? Do they need to apply for Medicaid? So it's a nice planning time that the division has now set up for families. And then we have conversations with families, help them out, explain the process to them. So that's one element I wanted to mention. And then the other thing is, for those adults that are in the seeking services category, if they're wondering when they're going to be selected from PUNS, you can actually email the division directly, provide the individual's full name and their birth date, and usually within 24 hours, you get a response saying, this is the anticipated selection date. So I'll put that into the chat if anyone's interested, and so you'll have that email address. So that's it, sorry.
No, thank you for jumping in.
Yeah.
So I'd like to go into eligibility for services, and then we can talk a little bit on applying for funding. So eligibility for services is based on someone having a diagnosis of an intellectual disability, so an IQ of 70 or below, evidence prior to the age of 18, or a related condition such as seizures, cerebral palsy, traumatic brain injury, autism, or Prader-Willi, that's found to be closely related to an intellectual disability. So that means that that condition results in impairment of general intellectual functioning or adaptive behaviors similar to those of individuals with intellectual disabilities. Related conditions must be evident or diagnosed prior to the age of 22. So part of our screening process to determine eligibility is based on a whole slew of assessments. One primary assessment being the psychological. We can't accept just any psychological. The division has put requirements on them. So a psychological is valid for the purposes of screening as long as it's completed by a licensed clinical psychologist or a certified school psychologist who has credentials from the National Association of School Psychologists. That psych eval also must include an assessment of adaptive functioning other than an ICAP. And the ICAP stands for Inventory for Client and Agency Planning. And it's ask questions about every aspect of life, how someone functions. So for individuals who have a suspected intellectual disability in the mild range, a psych eval is good for within 5 years of the date of our screening. For individuals who have a suspected level of moderate intellectual disability, we can accept one that was completed within the last 5 years, or the division will allow us to use 2 evals that were completed within the individual's lifespan before they turned 18. And then for individuals who have severe or profound intellectual disability, they only require 1 psych assessment on record. For individuals who don't have an intellectual disability and have one of those related conditions, they would need to have a psych eval within the last 5 years, regardless of what that related condition is. So here's the ICAP. Again, this is an assessment that is completed by our service coordinator. It assesses someone's adaptive and maladaptive behaviors. It helps us to determine the type of and amount of assistance that is needed. This assessment is valid for 6 months from the time of the screening. We will also have a medical history and physical examination completed. Both assessments must be within 1 year. Need to be completed by a licensed physician, an advanced practice nurse, a physician's assistant, or a registered nurse. However, if completed by a registered nurse, it does need to be co-signed by a licensed physician. Again, these assessments need to address the current health status and previous health status. And it must address the basis for diagnoses for individuals with epilepsy or cerebral palsy. Both need to include professional recommendations regarding the level of health support needed for the individual. Sometimes we need a psychiatric and a psychosocial assessment for individuals who have autism only, who do not meet eligibility requirements as a person with intellectual disability. We do need a psychiatric evaluation. We also need a psychiatric eval for individuals who have an intellectual disability, who may also have a major mental health diagnosis. So like bipolar disorder, major depression, schizophrenia. Psychiatric evals must be completed and assigned by a psychiatrist within 6 months of our screening. The division will allow them to be completed by a licensed psychologist, a master's degree psychiatric nurse, or a licensed clinical social worker if a licensed psychiatrist signs off on it. And then the psychosocial assessment is completed by one of our staff. So all of those assessments are used and to determine someone's eligibility for services. In addition to what we had already mentioned, we use old IEPs, we've used developmental evaluation, speech, language, anything that really helps us to determine what someone's individual needs are. The more information we have, the better. So we complete a screening. If for some reason we determine that someone is clinically ineligible for services, we will present that individual with their right to appeal. We encourage every individual who is determined to be clinically ineligible, we encourage them to appeal that, and we actually submit the appeal on their behalf. So perfect world, let's say an individual is found clinically eligible for services. Right now, there are only 2 ways to obtain waiver funded services in Illinois. You can either be selected from PUNS or meet the state's crisis criteria. There are non-waiver service options that we'll get into in a little while, but I'd like to go through the PUNS selection and crisis criteria first. So PUNS selection, they typically have occurred about once a year for the past few years. The division will notify individuals via mail, will notify individuals via email or mail. Once the selection has occurred, as long as you have Medicaid, we will assign you to a service coordinator and we'll begin that screening process. As Leslie mentioned earlier, the division has been doing PUNS pre-selections. They have been done approximately 6 months prior to the anticipated selection date. The division started doing this in the hopes of giving individuals and families more time to plan for services. There have been selections that have occurred and families will say, I never thought this was going to happen. I don't have Medicaid in place. They're having to find old assessments. So this really gives individuals and their families that time to get Medicaid in place, find those evals, start thinking about what it is that you really want in terms of services. Do you want them in your home? Do you want them, in a small group setting? Again, just as the PUNS selection letters are, the PUNS pre-selection letters are also mailed from the division, and then we also reach out. Other way to get funding is community crisis. The state defines a community crisis as homelessness, abuse, neglect, or loss of primary caregiver. I do probably 98% of our intakes for the agency, and when I say the word abuse and neglect to a parent, it's like, it's take this deep breath and, but I'm not abusing or neglecting my child. And we are not saying it has to be that way, but oftentimes it's benign abuse and neglect, that you may have an individual or a son or a daughter, or you're working with an individual whose behaviors are so severe that they're placing themselves, a parent, a sibling, a caregiver at risk for serious injury or harm. Or neglect. We work with a lot of families who have multiple children with disabilities, or may have one child with a disability, but a spouse who's ill. And you can't meet the needs of an ill spouse and a disabled child at the same time. So it's more of that passive abuse and neglect, more often than egregious abuse and neglect. So types of waiver funded services that are available. There are home-based supports for both children and adults. There are children's group homes, so that's children's residential. Community integrated living arrangements, so this is adult residential with a few types within that umbrella of SILA. And then there are community living facilities. So home-based services are designed to allow the individual to remain in their family home or their own home. So someone doesn't have to be living at mom and dad's house to have home base. They could be in their own condo or an apartment and receiving home-based services. Home-based services are expected to promote growth and independence for the individual with a disability. It provides a monthly allocation that can be used to purchase services. So it's not funding, it's not a check that someone receives in the mail, but it's a pot of money that you're billing against. So the current monthly allocations for a child between the age of 3 to 17, or adults between the ages of 18 and 21 who are still enrolled in a special education program, is $1,588 per month. For those who are 22 and older, or are between the ages of 18 and 21 and who are no longer enrolled in school, it's $2,382. So each year, if Social Security increases, then the home-based stipend amount also increases. So effective January 1st, the amount for children and those adults who are still in school will be $1,682 per month. And then for adults 22 and over and those out of school, it'll be $2,523 per month. So these next two slides are all the services that you can purchase using your home-based money. You're going to see that there's a lot more services available to purchase in the adult home-based program rather than the children's home-based program. But children who are in the children's home-based program also have their school programming. So again, you can use it to purchase in both programs, personal support. Let me switch slides here. So support workers. You can use it to purchase self-direction assistance. So for some of you, you may remember it used to be called service facilitation. So that's an agency like Ray Graham who helps you use your funding, find staff. Within the adult program, there's a lot, like I said, a lot more opportunities where you can use your funding. So regular work, community day services, supported employment. So a lot more opportunities in the adult home-based program. So children's residential, there's actually two types. There's children's group home and children's child care institution programs. So children's group homes, both settings, they are licensed by DCFS. A children's group home can serve no more than 10 kids, and the children must be enrolled in a school program approved by the Illinois State Board of Education, and their tuition for school is paid by the school district. Child care institutions are more, by definition, institutional in setting. DCFS is, like I said earlier, is licenses 19D settings as well. They can serve more than 10 children. Children must be enrolled in a school program approved by the Illinois State Board of Education. And again, the tuition is paid by their local school district. So for residential for adults, SILAs are, again, community integrated living arrangements. So living arrangements in which 8 or fewer people with a developmental or intellectual disability live together in a supervised home environment. Which it could include an individual or a family residence. There are different levels of supervision and support. The least amount of support would be intermittent CELA. So it's a home or apartment, again, 8 or fewer individuals living together with staff who are available 24 hours per day. They have on-site shift staff, but it's intermittent. So I think generally individuals start out with about 15 hours of support per week. And if they need additional hours, that we can apply for through the division. There's family CELA services. So this is where those residential supports are provided in the adults in their family home. The family is the primary provider of the service, but again, there's on-site staff available to provide support. There's also host family. So services are provided in the residence of a person with a developmental disability. Families consist of 1 or more persons who are unrelated to the individual with the developmental disability and who are under contract with a provider to provide that level of support. And then 24-hour CELA would be considered the most restrictive, which is again a home or apartment, 8 or fewer individuals reside under the supervision of an on-site shift staff 24/7. So there's always a staff member around. There's also a community living facility. These serve no more than 16 people in their program. It is designed to build skills, offer training, assistance with the goal of actually getting an individual in moving into their own independent living situation. There's only 9 facilities in Illinois. This program has drastically decreased in the last 10 to 15 years. Individuals who live in a CLF are required to participate in some sort of day activity, whether it's voc training, shelter workshops, regular employment. So for those individuals who haven't been selected from PUNS, we can't prove that they are in a crisis situation. There are some non-waiver service options available. First, in-home respite. So it's a grant program that provides short-term services to children and adults, typically within their home, to give relief to the people who are normally providing their care. So primarily mom and dad. Clearbrook is the agency who has the grants in our area. Out-of-home respite is a program that provides supervision and care to kids and adults with developmental disability in a licensed residential community-based setting, so outside of their family home. And typically, we've seen this where I know of a family who used it. There was a death in the family. The individual went and stayed there. I think it was 48, 72 hours. There's also an ICFDD. ICFDDs, when you drive by them in the community, structurally, they look like, most of them, I should say, structurally look like a nursing home. They are licensed by Department of Public Health for 3 or more persons. It is extremely rare in this area to find an ICF that is actually less than 6 or 8. But more than 50% of the individuals that reside in an ICF have either an intellectual disability or related condition. Again, individuals who live in an ICF, similar to CLF, you are still doing some sort of day activity. We have individuals who go to day programs. We have individuals who have, supported employment. Then there's also the supported living program. So this was designed for individuals ages 22 years and older. It started with individuals with physical disabilities, but who need long-term care, but can live a little bit more independently and might need a little bit more assistance. So they do take care of, housing, personal care. There's, 24-hour security, there's activities, but this would be for individuals who are a little bit more independent. So individuals who are in waiver-funded services will have a person-centered plan. The person-centered plan is a good balance of what is important for a person and what's important to a person. It focuses on outcomes that is identified by the individual receiving the waiver-funded services. So years ago, we used to, well, I should say we, but service providers such as Ray Graham would write service plans, and there would be goals, and they weren't always attainable. They were long-term. The person-centered plan, again, is focusing on what's important for someone and what's important to them. So rather than, rather than focusing on something that may not be as functional as we would like, the outcomes and personal plans are now much more person-centered. Our staff, the service coordinators, are writing those person-centered plans. It starts with the discovery, and really it is a tool that we use to guide the discussions. But it's, what people need in every aspect of life. What are risks? How are those risks currently being mitigated? What the individual wants in the near future, what they may want in the distant future. Once that discovery tool is written, we use that to develop the personal plan. When an individual is linked with a provider agency, the provider agency then writes in what's called an implementation strategy on how they're going to help that individual achieve that outcome. Leslie, is there anything you would add to the planning process? Leslie, there?
Sorry,
Okay.
I was muted. I was muted because I'm typing chat responses.
Oh.
No, I don't think so. It is a very personalized process. We really get down to having conversations with the individual and their family member, and try to come up with just a long-term plan and focus for the individual, and that focused maybe 3 years down the line for somebody. It could be 15 years. It just depends on what that individual and their family would like.
I know there's some ISAs on this call this evening, so if you have anything you'd want to add, put it in the chat. But the personal plan is meant to be a living document. It should always be added to when needed. It shouldn't just be something that's looked at once a year, as service plans or IEPs. IEPs were. So it's a much more, again, person-centered process where the individual, they play a primary role in the development and the writing of this plan. So it's a lot of progress has been made in the past few years with the person-centered plan. So once someone is in services, they will have what's called an ISA. So that's an individual service and support advocate from our agency, as long as they are within our service area. If they move out of our service area, we will transfer the case to one of our sister agencies. So your ISA is going to support the individual, their guardian, and providers in working through service issues if they come up. Again, your ISA will be writing the personal plan moving forward. It is designed to assist, obviously, but not replace a guardian or any other advocates. They will, right now, conduct at least one monitoring visit per year for adults and at least 3 for children, with another visit considered the discovery visit. And I think that is it.
I think I'll just add in here, it'll be easier than typing. Someone had asked, where is it? What's the difference between doors and PUNS? So PUNS is simply a wait list to be able to access Medicaid waiver services for individuals with developmental disabilities. So doors, and Mike can talk about this when he's on, but doors, the focus is for individuals with primarily physical disabilities, and not that our folks don't benefit from those services as well, but generally we have different avenues under the DHS umbrella. We have our mental health division, we have our division of developmental disabilities, we have our division of rehabilitation or department division of rehabilitation that is more the physical, and then we have like senior services. So the difference being in general terms is DD services versus physical disabilities. And that PUNS is really just a wait list. It's not the actual services themselves. So if someone's selected from PUNS, what you're getting is an invitation to apply for Medicaid waiver services for folks with developmental disabilities. There's no guarantee attached to that. You still have to go through the eligibility screening. So I hope that answers the question. If not, please put it in chat and we can, or speak up and I can address it better. Okay.
All right, so let me stop sharing here, Mike, and turn it over to you.
Okay. It's funny. Well, Clancy, you were the one bringing up the DHS, doors, ORs, all that alphabet soup that.
Yes, it's changed over the years, right?
And it certainly has. Like back in the 70s, we were Division of Rehab Services. We were wait, well, I can't even remember what it was. DVR.
ORs.
Yeah.
Or
In the
VR.
ORs in the, when I had my aneurysm in 92, that was doors. And now we're part of Illinois Department of Human Services Division of Rehab Services.
Okay.
So they really want to get that IDHS, DRS in there. And who knows, but that might change at some point too. So, like Kim said, as far as what happened to me and why I got in the field in the first place was, it'll be 30 years ago in August that my dad's, he owned a deli in Oak Brook, and he said, go get tomatoes at Discipio's, which is a vegetable stand. So I'm in the parking lot, and all of a sudden I feel hot, and I just quickly say, oh, I got to get some air. I open the door, and I just collapse out of the door. I fall out of the car, and I try and get up, and I can't. I flopped again, and then I start panicking and yell for help. Thankfully, there was a worker there from Discipio's that heard me and called 911. I was able to get my parents' work number out. So my mom came, and I ended up going to LaGrange Hospital by ambulance, of course. And they, of course, being 21 years old, they kind of thought it was a drug overdose or something along those lines. But what it really was a brain aneurysm, arterial venous malformation, to be specific. So an artery and vein connected where they shouldn't have been. And went through treatment at LaGrange Hospital for about 10 or 12 days in intensive care. And then they clipped the aneurysm. So there's a clip in my head that stopped the bleeding. And then I went on to Marion Joy in Wheaton as an inpatient. Oh, yeah, it's still Marion Joy. It's under Northwestern now. And got great services there, of course. It was about a month into my rehab where they found that I was blind in my right eye. I didn't even realize it. I was so out of it. I didn't know that I couldn't see. And that was from the aneurysm that blood pushed through and caused the blindness. They did do about, weeks later, they did a surgery that corrected that or got rid of the blood. And then from Marion Joy, I went into an outpatient program at Marion Joy at a facility in St. Charles. So I was there for some time, and they really got me going as far as get my arms going, get walking, and not worry so much about form, just get the movement happening. And wearing a leg brace, and still do. I've been able to be mobile and move about. And it was at Marion Joy in St. Charles that I met my doors counselor, who said, we can help you. Maybe you're not ready right now, but we're going to be able to help you. My thought was, aneurysm in August, I'll be back to school in January. I was at Bradley and Peoria, and that wasn't realistic. My family said, you can't walk and you're kind of having a hard time. You got to rehab, is what it came down to be. So I was disappointed, of course, to not be able to go back to school as quick as I thought I was going to or wanted to. But looking back now, it's like, no, I just wasn't ready. So went through rehab and got out of a wheelchair to be using a walker, and then ultimately a cane, and then just the AFO, the ankle foot orthosis or leg brace to help me walk. And through the Doors counselor, she presented the opportunity. Doors and my counselor provided me with the opportunity to go back to school. I thought I could handle a full, like 12 hours or 15-hour course load for the fall of '93, but that wasn't realistic either. And thankfully, someone, might have been my mom or dad, that said, let's try a couple of classes and see how it goes. And that worked out well, because I got to go back and succeed. And sure, it took me a little longer to get graduate, but I was able to graduate from Bradley, which was great. Getting a degree in public relations, and armed with that, I felt good, like I can find a job now. Well, I really didn't know where to look or how to do all that. So again, my counselor connected with her, and she said, hey, we have job placement services we can provide you. So I started working with an agency called IM Cares. I don't think they're around anymore, but they were at that time. And got some placement services from them. And along with that, I stopped for a bit, and actually I went into more training for vocational training through United Cerebral Palsy, or I guess it would be called UCP segment at this time, or now that is what it's called. And got some help as far as just the basics of looking for work, preparing for interviews, getting a resume set up, helping me apply for positions, and ultimately get a job, which is what I did. Not that the UCP did help me, but it was my grandfather sitting at a bar that happened to know someone that knew someone, one of those stories of networking. The guy that owned the Steamax was in Hillside. That's the name of the bar restaurant. He was a board member at it's called Aspire now, but it was the Proviso Association for Retarded Citizens, and helped me connect with them and get a job there and work. They wanted me to go full time, but no benefits. So I said, no, I can't really do that. So back to a job coach, back to IM Cares, and they set me up with a job interview with Spectrum, Little Friend Spectrum, and I ended up getting a job there as a job coach. I really enjoyed it and was there for 5 years. Had a coworker that was going through a master's degree program and said, I think you'd be good at doing this. I'm going to go ahead and leave here to go become a VR counselor, a vocational rehab counselor. And once I got my master's, I applied for the job through the state website. And ultimately, but it took a year. And finally, I got the call and got interviewed and accepted the position. And I really feel like it's where I was meant to be here. I was meant to be a rehab counselor. I feel good about helping people and kind of knowing what they've gone through or are going through. It might not be exactly the same, but I can say, yeah, I was on that side of the desk at one point too, saying, can I do this, or what am I going to do, or how am I going to get this help? So I feel real good about the agency that I work for, that we are able to help people with disabilities in various ways. And I see a couple. Let me see the chat box and see if there's questions or anything. No, that's from the last. If there are any questions, feel free to stop me or just throw something in the chat and I'll respond to it. So what we do at Division of Rehab Services, DRS, is help people with disabilities find employment and or training. And we help people with various different disabilities. As long as the criteria is, it has to be a disability that's an impediment to employment. And if a customer is able to benefit from our VR services, we'll be able to, open up a case and get services started or connect them with services to begin. Now, as far as how to apply, there is our website, the state website, which is dhs.state.il.us. And there's an online form there. And also, we're under that big umbrella of Department of Human Services. So it's not called Public Aid anymore. It's the Community Family Resource Center. So that's for people that are in need of food sources or medical assistance. I see a question here. Okay. Thanks, Sharon. She's saying the links are provided. So someone could apply for services online, or really they could call me. I'll put my number in the chat right now. Wait, 630. My phone is 217-851-6728. That's a direct line to my cell. Intake process. So whether you call me or do it online, ultimately you'll get assigned a counselor who will contact you. And right now, due to the pandemic, our office is closed to the public, so we're doing it through phone. Of course, we can do like FaceTime and Zoom. And that's the counselor will contact you to set up an intake appointment, an initial interview. So it's at that time where me as a counselor, I'm going to gather information about your case or your disability. I'm going to ask you questions about what is your disability? What are some of the barriers to employment that you experience? What do you consider your functional limitations as far as how do you get around? Can you do that independently, or do you need assistance or help with that? What is your do you take any types of medications? I don't really need specifics, but I just want to get a broad idea of like what a person's functioning level is at. What's very helpful is if someone has their records from like a school records, like their IEPs, or if they can get doctors information, doctors records, and we can have a individual customer sign off on a release to obtain those records. I know some doctors' offices or hospitals charge. That's something we can pay for and obtain the records. Repeat my phone number. That is 217-851-6728. That's a direct line to my cell. And my email is my name, michael.pesola@illinois.gov. And the word Illinois is spelled out. As far as who we help people with physical disabilities, those that have mental illness of some sort, bipolar, ADHD, people that have autism. We also have a counselor that helps those that are deaf and or hard of hearing. We have a Bureau of the Blind services, so those with visual impairments, and we have a counselor that's specifically helps those with that sort of those sort of conditions. We also help people, our students, transition age students, kids that are in high school. Usually they are in a transition program while they're in school. And like, for example, I have the Elmhurst District 205 York transition program is my caseload. But there are other counselors that have, say, Downers Grove North and South, Glenbard, the Glenbard schools, East, West, that sort of thing. That they'll go to the IEP meetings and learn about, attend the meetings, and that gives, like in my example, it's a good chance for me to get to know the person a little bit more until they age out at the age of 22, or they take their diploma early, and then they end up coming to me and getting services such as job placement and coaching, or help with training such as college education, college training. We also help, besides college training, we have helped people get through beauty school or truck driving school. So really there's nothing, I wouldn't say no. I would say, let's see. I would never say no right off the bat and say, no, we can't do that, or there's no way we can help someone get through that training or program, because our director is, her name is Ronnie Patrick. She's, of course, down in Springfield. Individual with a disability that has been a real great advocate and has been in the field for many years, who's always helping and believes in helping people, helping them through getting training, school training, or of course, vocational services, job placement. So as far as the process goes, the rehabilitation process, once, we have that initial interview, and then once I get the records of an individual, I will certify that person eligible, meaning, yes, they have a disability. Here's the proof. Here's the records that are showing what their deficits are. And they could be, there's 7 categories. The first one is mobility. Can they get around? Can they move about from place to place? Can they utilize transportation independently? The next would be communication. How is their speaking skills, their reading and writing skills, their reading comprehension? So a lot of that data is coming from an IEP record, or a neuropsychological, or a psychologicals, whether that be from a school or from something that they got on their own, or through some other agency or funding source. Ultimately, what we do is, what I do, and my fellow counselors, is put someone to a plan. Now in schools, high school, it's the individualized education plan, the IEP. When they get to our program, it's the IPE, the individualized plan for employment. So that's going to lay out the services of what we're going to do. The core services are always guidance and counseling, which is my meetings between me and the customer to talk about his or her job goals, what they want to do, if they're working, if they have work issues or problems. We'll discuss those things. The second core service is information and a referral. So I had a call today that someone was asking about their daughter who moved. This was a person that was on my caseload and got employed and closed the case out. She moved to Clemson to do a PhD program. So now she's got a housing issue there. And I said, we're here in the Chicago area, in Downers Grove. I don't know what's in South Carolina, but I sure as heck am going to try and find out. I should say that every state has a division of rehab services. They might call it something different, but no matter where you are, all 50 states have a Department of Voc Rehab or or similar program that offers the same services that we have. Another service that I forgot to mention was the home services program. So that's for people that are under the age of 60 that are that need help to stay in their home, to keep them out of nursing home. The criteria is, yeah, they have to be under. Wait, I don't even know what it is. I'm not. I'm somewhat familiar with it, but I'm not the greatest at it. Customer has to be under the age of 60 at the time of their application, and they need to be on Medicaid or be Medicaid eligible to receive home services. And the services that, if they're eligible, if they meet the criteria and they are eligible, one part of one service they could get is the PA services, personal assistance services. So they hire the person who's going to help them, and that person, that PA, can help them with general cleaning and light cooking, that sort of thing, provide companionship. I'm trying to think of other services. It's basic services such as that. We also have a program, or along into the home services program, is the traumatic brain injury, TBI program, to help those that have had a TBI. Depending on it, again, with meeting the criteria, we could help with home modifications. Maybe help with if someone needs a ramp or some kind of modification of their bathroom or a doorway. We could certainly try help with that. Switching back to the division of the voc rehab part of things, and the college training. Individual, the first thing they should do is, well, no, wait, let me start with the Community College Initiative, CCI. We'll pay for someone to go to, we'll pay for tuition and fees and books for, like, for example, someone to go to college at DuPage, local school, the local community college. Now, if someone goes to U of I, Champaign-Urbana, say, we'll help pay, but we pay at the we have limits on that as far as that's the highest we pay is the U of I Champaign-Urbana state rate. If someone wants to go to Northwestern or any other college that's private or more expensive than U of I, they can go there and we'll help support, but we'll only pay at that rate of the U of I Champaign-Urbana. As far as time of what we give people to finish their degrees, we will pay for 3 years for someone to get their associate's degree and 6 years for someone to get their bachelor's degree. Now, they must maintain at least a C average and provide me with grades so I can kind of track and see what's going on with the student, with their studies and how they're doing. We can also pay for a master's degree. I need to check the criteria, the rule, but I think it's the customer has to pay 10% of what it costs to go to the master's program. Any questions on any of that?
Mike, I have one question for you. So previously we had been told that for the home services program, someone had to be of age 12 or older, but we recently had a client that was younger than 12. So is there a minimum age that the home services program will serve?
I've been told that I need to check that,
Okay.
But I was told that those that are under should go to the Division of Specialized Care. But I'm not sure if that's really true.
Okay.
And those that are, I forgot to say, those that are over the age of 60, they have to go, or they what I would do if someone says, hey, I'm 70 and I need services, I ask them to contact the Illinois Department of Aging. Or, yeah, and I'll put these two numbers in the chat. I also have the DuPage County Senior Citizens. I'm sorry, DuPage County. Yeah, DuPage Senior Citizen Services. That's like the county farm road building or buildings. So, yeah, there's that. Let me put that in here.
Everyone, this is Sharon again. In case you are on a phone call and can't see the chat, feel free to email and I'll provide my information later. Email me and I can forward you any of the links or information that Mike is sharing in case you cannot access it through the chat.
Just briefly about a customer wants to, they're interested in getting a job and obtaining employment. I really like the services from Ray Graham Association. There are other agencies, like I mentioned, Spectrum and Parents Alliances and Lyle. But I have to say Ray Graham is doing an outstanding job. So what I would say, one of my customers says, yeah, I want to get help. What I do is write up the plan and the IPE, the Individualized Plan for Employment. I have to put a job goal, and I work with the customer, or the customer tells me it's their plan. So I'm going to say, hey, Jane Doe, what would you like to do? What do you think you would like to do? They might say, I want to be a teacher assistant, for example. I put that on the plan. And then along with those core services, the info and referral and guidance and counseling, I put job placement services, job development, placement, and coaching services. So that coach will meet with the person pretty much on a weekly basis to help them find work. I know during the pandemic, things can be different though. It could be by phone or just a Zoom. But ultimately, Jane Doe and the job coach are going to help. They're going to work together to apply for jobs. The coach is going to help that person prepare for the interviews. And then ultimately, when the person gets the job, the coach is going to help them be on site and on the work site to help them make sure they will know the job tasks. The job coach can communicate with the customer and with the manager of the store or a business, wherever they're at, to say, hey, how's Jane Doe doing? Are things going well? If they're not, they can work on strategies to improve Jane Doe's performance. A lot of job coaches are, they use task lists. They're very professional and creative, and they're ultimately they're really helping the customer get the job and maintain it. My role in that, once the person gets a job, well, and even before that, is to have these 8-week staffing. So we all meet, the job coach, myself, and the customer meet to talk about how things are going, work progress, how the job placement's going, or how the job is going. The customer doesn't have to stay in the job or stay with the agency that they pick or refer. I refer them to. If they want to make a change, they have the right to say, hey, I'm not cool with this, or it's not working out. Can we do something different? And we certainly can. They also have the right to appeal any decision that I make, or if I deny them something, they have the right to contact Client Assistance Program, CAP. And hopefully the situation can be managed by my supervisor. But if we need to go through the channel of CAP and get the CAP rep involved, we can certainly do that. And then ultimately work on the best plan for the customer. Here's a question in the chat. If someone completes an associate's degree through Doors in 3 years, will Doors then also support them with 3 years to finish a bachelor's? Yes, correct. That's how that works. So it's 6 years to get that bachelor's. Yep. Yeah. It's definitely how we're doing it. That's how it's done. Trying to think if there's anything else like.
Sorry, this is Sharon. We have a couple minutes left before the next presenter. There's a question right above that. I don't recall if you answered it. If you have, please forgive me, but it says, does a person have to be on Medicaid to get services through DRS, specifically persons who are legally blind?
No, the blind services, if they do a, set up a referral, we take a referral, and then their disability is the blindness or visual impairment, we can certainly help them. Yes, I could certify them eligible because that impairment or blindness is an impediment to employment. So either they're going to give me, I'm going to get records, or they're going to provide them to me, and I'm going to certify them eligible, and then ultimately get them into a plan to go on through the other services, or help with getting them what they need. If they're looking for work, then that's what we're going to help them with. We also have a benefits specialist. I think we used to have one that was like in DuPage County, but I believe now it's like the person is in Springfield. But they work out well, and I mean, I need to recontact or get contact with them, but we can help, because some people are worried like, oh, I get SSDI, and what happens when I work? Am I going to lose that? Well, that's where the benefit specialist is going to come in to help us figure that out, to make sure that, or see how we can help maintain the keep the SSDI benefits and work, or give them an opportunity or options, like a clear picture of what it's really like. If you do work and you make more money, you'll be making more money and you won't need the SSDI. Maybe it's better for that person to work more and earn more.
Is it quick follow-up question? An age cap, sorry. It says, is there an
for
age
the
cap?
voc rehab? No. I've had customers, I think my oldest was like a 75-year-old. So yeah, no age limit on that. If someone at 90 wants to work and open up a case, great. Here we are. Let's go. Yeah.
Awesome.
If you think of any other questions, feel free, like I said, to call me or email me. So thank you.
Thank you, Mike. There are a few questions in the chat, but we'll circle back to them a little bit later. And we're going to move on and ask Alexandra Baig to unmute and present her portion of tonight's session. Following her portion, that is when we'll have some time for question and answers and a little bit of wrap up. So again, like Mike said, feel free to put your questions in the chat and we'll make sure we do our best to get them answered. Thanks, and thank you, Alexandra.
Thank you. Can everyone see the PowerPoint?
Yes, I can.
Okay, so we've heard a lot about services, both from DRS and from our friends at the IC. And one thing that all of these services have in common, well, many of them, not all of them, many of them is, for many of these services, the person needs to have Medicaid, right? Not all of them, but many of them. And so I thought I would do my part, since I'm the benefits person at Clancy & Associates, and I often assist people with the ins and outs of Medicaid and also Social Security. I thought I'd look at some of the various routes to Medicaid that a person with disabilities can use. So, okay, so the differences between school services and adult services. So this sometimes, I think, takes families by surprise, but school services, as we all know, are an entitlement. If the student needs the service, family can make a case. The student is given the services, the school is required to provide the services. And that's because the school districts are required to use their funding to pay for services, and that funding is generated from tax dollars, right? So students are owed those services for their free and appropriate public education. But world of adult services, as we all know, is a little bit different. Adult services are not an entitlement, right? And the agencies that provide adult services are mostly nonprofits. And those agencies, as we all know, I think, or bill DHS for the services, and the dollars that eventually pay for those services come from Medicaid, tied to the eligibility of the person who's receiving the services. So as a result, right, and I think Rebecca said this, a person with an intellectual or developmental disability can only receive adult services in most cases. There are some exceptions if she or he is selected from the PUNS database and if she or he is eligible for Medicaid. In Illinois, and in most states, there are multiple eligibility routes into Medicaid, right? So in Illinois, people with disabilities can qualify for Medicaid under these different categories, right? So they can qualify as a low-income adult. They can qualify as a person with a disability who receives supplemental security income, SSI. They can qualify as a person with a disability who used to receive SSI, but whose income from certain sources is now too high for them to receive an SSI cash payment. They can qualify as a person with a disability who works, and they can qualify as a person with a disability whose income is above one of the Medicaid thresholds, but who has out-of-pocket medical or personal support expenses such that if those expenses are paid, the income would be reduced below the threshold. Right. So when Illinois expanded Medicaid under the Affordable Care Act, which is also sometimes called Obamacare, it permitted any adult to qualify for Medicaid if they had no other health insurance coverage and if their income is low enough, right? So people can qualify for Affordable Care Act or Obamacare Medicaid regardless of disability, as long as their income is low enough, right? And the threshold, that income threshold, is 138% of the federal poverty level. And I'm sorry, I was supposed to put the number in there for this year. The eligibility for this kind of Medicaid is based entirely on, again, the low income. And disability is irrelevant. As a result, if the person's income rises, they may no longer be eligible. And one of the challenges is that I believe that the Medicaid instructions, the people who do intake for Medicaid, their instructions are to first try to put the person into this Affordable Care Act category of Medicaid eligibility. And then, if they're ineligible for that category, to look at the other categories for which they might be eligible, right? So another category in which a person with a disability might be eligible for Medicaid is if he or she receives SSI, right? And this category of Medicaid eligibility is typically referred to as aid to the aged, blind, and disabled, which we abbreviate AABD, right? Now, in some states, if you apply for SSI and you're approved, you automatically get Medicaid. That determination is made actually by Social Security, but in Illinois, you have to apply separately. And the income criteria, there's a separate income criteria than for SSI, but generally the rules around this kind of Medicaid are similar to the rules for SSI, right? You can't have more than $2,000 in assets, and you can't have income over a certain level. The income threshold, which I'll show you a comparison of the income thresholds on a later slide. The income threshold for this type of Medicaid is lower than for the ACA Medicaid. Now, people who receive SSI and Medicaid together, particularly if they obtain those two benefits when they're fairly young, for instance, right when they turn 18, they may in future have an increase in income that precludes them from continuing to receive SSI. However, if you at the past have SSI and Medicaid together, right, and you're eligible for Medicaid under that SSI linked AABD category, and then your income increases, there are programs or there are regulations within the Social Security Code that allow that person to keep his or her Medicaid status. So what happens is the person continues to be eligible for SSI because they still meet the medical criteria for that disability. But because their income has risen, they are in what's known as zero pay status. And since they still technically have that SSI eligibility, they maintain their Medicaid eligibility. And the two program categories for this, or the two regulatory categories for this, one is called 1619B, and that's for a person who formerly received an SSI cash benefit and had Medicaid concurrent. But then because they worked and they began to earn income and their income was high enough that they were no longer eligible to receive an SSI cash benefit, they may still maintain their Medicaid eligibility, right? 1634 is the category for people who used to receive SSI in the past, but they begin to receive a Social Security benefit, typically one that is based on their parents' work record. And that benefit is so high that they are no longer able to receive an SSI cash benefit or cash payment, but they maintain their Medicaid eligibility. And for this reason, at Clancy and Associates, and I think elsewhere, we strongly encourage young people when they turn 18 to apply immediately for SSI and then for Medicaid, and to have those two benefits overlap for at least a couple of months, even if the young person has the capacity to work and earn over the Medicaid or over the SSI threshold and will then stop receiving SSI. Because once you've had SSI concurrent with Medicaid, you have these avenues for continuing your Medicaid even when your income rises. So it's like a safety net. Okay. It is also possible to obtain Medicaid as a person with a disability who works. And this is particularly useful for people who missed the step of applying for SSI, right? Maybe the person is pretty capable. Maybe they have primarily a physical disability, and so they're able to do work that doesn't require a lot of physical activity. And so they bypass that step of applying for SSI. They never have SSI and Medicaid concurrent, but later they realize that they need services and that those services are funded by Medicaid waivers, and now they need Medicaid, right? So in this case, the person can use the Medicaid buy-in program. Most states have them, and that program in Illinois is called Health Benefits for Workers with Disabilities. I'm sorry, that should be HBWD. There is a sliding scale premium to use this kind of Medicaid, and people with a disability and incomes up to 350% of the federal poverty level can qualify for HBWD, which is approximately, it's around $40,000 this year. And finally, a person may fit into or be eligible for Medicaid because even though their income is over the typical Medicaid thresholds for any of these programs, right? Or maybe they don't work, so they can't use the program for workers. If they have income or assets that are over the threshold for Medicaid, they can use what's called spend down. And that's just what it sounds like. You can think of it kind of like an insurance deductible that you might have for your health insurance or your car insurance. If I have assets that are too high to qualify for me to be eligible for Medicaid, I can use those assets to pay for medical expenses or support expenses. And once I've reduced the assets to below the threshold, I am now eligible, assuming that I meet the medical criteria for having a disability, or the medical or other a developmental delay criteria. Similarly, if my income is too high for me to meet the Medicaid eligibility threshold, but I have recurring or ongoing expenses for either medical or support needs, I can submit those bills, and those bills will be used to reduce my income such that I'm now eligible, right? There is also an option, there's a sort of a hybrid program called pay in, spend down, so that if a person has income that's over the Medicaid threshold, but perhaps their service or medical bills fluctuate from month to month, and some months they might not have enough to reduce their income below the Medicaid threshold, they can just pay that amount, right? So they can just pay that amount to DHS. That way they've met their spend down by paying just directly. So this is the financial criteria for the various Medicaid categories, right? So if you are a low income adult and you are looking to apply under the Affordable Care Act version of Medicaid, then you would have an income limit of $1,366, and there's no asset limit, right? Assets are not relevant for that program. If you are looking at AABD Medicaid, which is that SSI linked Medicaid, you have an income limit of $1,073, right? These are all for individuals. If you're a couple, there's a higher threshold, and you have an asset limit of $2,000. Because 1619 and 1634 are continuations of AABD Medicaid, the asset limit remains the same, but the income limit changes. For 1619B, you have a limit on earned income of over $3,000. For 1634, your limit is whatever that benefit that the person receives based on their parent's work record, what we sometimes call a disabled adult child benefit or a childhood disability benefit. That benefit, which is based on the parent's work record and would come to them when the parent starts receiving their Social Security, that benefit then becomes the limit for their 1634 categorization for Medicaid. Health benefits for workers with disabilities. The income limit is $3,404, and then that has a higher asset limit of $25,000. Spend down, it just depends on how many expenses you have, right? If you have very, very large recurring expenses, then you can use those every month to spend down. Therefore, you could have a higher income, but using those expenses would still reduce it below the threshold. I should mention that although there is a stated threshold for 1619B, which again is when the person is ineligible for the SSI linked Medicaid because they have too much income from work, although that is a standard threshold, it can be customized if people have a very high amount of medical or support needs. So you can actually request an individualized threshold that is higher than that $3,195, but you have to have a certain level of medical or support needs to justify that. So if you will bear with me for a moment, that is the initial part. So I focused on Medicaid here because, again, Medicaid is, if you will, the fuel or the funding, the ultimate source of funding for many kinds of adult services, although not all. I'm going to pause the share for a minute and switch over to a different set of slides to talk a little bit about how work affects a person's capacity or eligibility for benefits. Okay. Some people, and I think Mike made reference to this, some people who receive Social Security benefits and Medicaid are concerned that if they work too much, they will lose their eligibility for benefits. And while ultimately that may be true, and as Mike said, that's not to say it's not a good path, right? Because they might be earning enough that they don't need those benefits. There there's certainly a stretch of time, perhaps a very long time, when the person really does need to maintain the benefits as well as have the income from work, right? And the reason for that is that perhaps they're in a kind of job that's hourly, where their hours vary a lot. Perhaps they're in a field of work that is not particularly stable. Perhaps their disabling conditions also vary in severity, so that they may not always be able to work at the level that's where they can pay their bills, and or they might experience a change in circumstances for other reasons, right? Perhaps the supports that they had at one job are not there anymore. So in many cases, we want to help the person with the disability understand what are the things they can do to maximize both their benefits and their earnings from work, right? So for SSI, it's a pretty simple formula, right? If you have SSI and then you start to work, the first $85 of your earned income, right, has no effect, $85 per month. Now I'll back up a little bit and say, if you're a student, right, there's a much higher earned income exclusion, right? So if you're a student under 22 and you work, you can actually earn quite a bit more and it won't have any effect on your benefits. But for an adult who's out of school and over the age of 22, if he or she starts working, that adult, then the first $85 will have no impact on their SSI, and every dollar after that will reduce the SSI by 50 cents, right? And that's why if you do the math and you know that the maximum SSI benefit is $794 this year, it works out to be about $2,700 that the person can earn before they have reduced all of their SSI benefit to zero. Okay. So Social Security Administration is aware that people who begin to work and begin to earn over what they call substantial gainful activity may no longer need the cash benefits of SSDI or SSI, but they may continue to need Medicaid or Medicare. So sometimes they do continue to need those cash benefits. Sometimes it might be more the Medicaid and Medicare, which are linked to those cash benefits, right, that they're going to need. And it may be that people with disabilities, many people with disabilities, though not all, requires services and supports in order to work. So they can work, but in order to work, they have to have the services. And in order to have the services frequently, they have to have Medicaid, right? So the Social Security regulations have a number of what are called work incentives that are designed to help a person with a disability go to work, but still keep their benefits, right? So one of these is what's called the Ticket to Work, which is a free suite of services that help people with disabilities start, return to, or enhance their work. Anybody who is getting a disability benefit, whether it's supplemental security income, SSI, or a Social Security disability insurance, SSDI benefit, they have a ticket, right? You're in the system, you have a ticket. I understand at one time they used to mail you a paper ticket, but they no longer do that. And the Ticket to Work can provide the services that I have listed up there and others, right? Division of Oak Rehab is a Ticket to Work service provider, or what they call, and then there are also private sector agencies, which are referred to as employment networks. And the ticket users, people who begin to work with either DRS or a private sector agency and assign their ticket to that entity, as long as they're making progress, right, towards their work goals, they are exempt from ongoing disability reviews, right? And everybody has their acronym for the person-centered planning. In the world of Ticket to Work, it's called an IWP, Individual Work Plan. Okay, so beyond the Ticket to Work, Social Security work exclusions, there are some that apply only to SSI, and there are some that apply only to SSDI, and there are some that apply to both. We talked about this just a minute ago. The first $85 or $65 if you have some unearned income, right, is excluded. So there's no impact on a person's SSI from those first dollars that he or she earns, right? And after that, only half of their income reduces their SSI, because remember, it's a 50%, 50 cent on the dollar reduction, right? So that collectively is an earned income exclusion. As a student, the earned income exclusion is much higher. Students who are full-time and under the age of 22 can actually earn close to $2,000 a month, up to $7,700 a year, and still have no impact on their SSI, right? Another work incentive is what's known as impairment-related work expenses, which are called IRWE. And those are expenses that the person with a disability incurs because of their disability for services, supports, medical care that they need in order to work, and they pay for it out of pocket. So I have on the screen some examples of what might be considered IRWE. Basically, what you do is, if you have IRWE, you have to have it approved by Social Security on a case-by-case basis. And once those IRWE have been approved, then the Social Security Administration will deduct them from your wages, your reported wages, every month. And what's left is your countable income. So it's a way of reducing how much of your income from work Social Security counts. And that can assist you to keep your benefits, both SSI and, as I will show later, also SSDI, and by extension can help the person to keep their Medicaid if their Medicaid is tied to SSI. Right? There is also something called an employer subsidy, and this can be very, very useful. And that is what happens if the person with a disability can say, and their employer can attest to the fact that the person has accommodations. And due to those accommodations, they are not as productive as an employee who does not have those accommodations, right? But they are paid the same, right? So these are accommodations that the employer makes willingly, but because of the accommodations, the person is not 100% as productive as a person with the same job title, but no accommodations, right? And there's some examples there, right? So the person might be able to take more breaks. They might complete less work, right? But they'd still be paid the same. There are, as a form that the employer needs to fill out to attest to Social Security that this kind of subsidy is in place. And then the person with the disability will often also be asked to fill out a form that explains the accommodations they have. Right? And then we talked about 1619B, which is that even if using all the work incentives you have on hand, using your IRWE and your employer subsidy if they apply, and taking into account your earned income exclusion, again, if with all that counted, the person still earns too much to get any SSI, right, they would still be able to continue their Medicaid. Right. So I'm going to switch over one more time. I apologize that I'm switching. It's because there's a number of presentations that feed into this, and I'm trying to use the ones that are most relevant for our situation here. And then very quickly, I will talk about the same situation of how one can continue with SDI benefits while working. So this slide is the same, but oops, I'm not getting a click here. Okay. So with SSDI, basically the question is whether or not you are earning above the substantial gainful activity threshold, which is $1,310 a month, right? A person has So a person may have SSI simply because they have a disability and they have a low enough income. A person would have SSDI because that person, him or herself, had sufficient work credit, or they were getting a benefit based on their parents' work record because they have a disability that started before their age of 22 and their parents are now drawing Social Security, right? So with either of those benefits, which are grouped together under Title II of the Social Security Act, the question is, it's with SSI, it's a situation where if you start to work, your benefit gets a little lower. With SSDI, whether it's on your own work record or on that of a parent, it's an all or nothing situation. Either your countable earned income is below that threshold of 1310, that's the number, or it's above, right? And if it's consistently above, you no longer meet the Social Security definition of having a disability, so you don't get your benefit, right? But again, there are work incentives that can help this, right? Impairment-related work expenses are also relevant for an SSDI situation. Just as with SSI, if you have IRWI and Social Security approves them, then those are deducted before Social Security counts your income, right? So if you have $1,500 worth of income, but you have $300 worth of IRWI per month, now you have only $1,200 of countable income, and now you are below the threshold that's considered substantial gainful activity. So even though you're earning $1,500, you're still able to retain your SSDI benefit, right? Similarly, the employer subsidies are also relevant for SSDI. I have a client situation with a client in another state who his employer attested that he's only 50% as productive as employees without the accommodations he receives. And so he's able to earn twice the SSDI threshold, that substantial gainful activity level, and still maintain his cash benefit, right? With SSI, you never actually really lose eligibility. You just might go into that zero pay status if you earn so much that the 50 cents on the dollar reduction reduces what's payable to you to zero. But with SSDI, there's a different process. And there's stages that you have to pass through before the Social Security Administration decides you are no longer eligible because you're working too much. And the first of those stages is what's called the trial work period. And the trial work period is a time during which, and it can be up to 5 years, a rolling 5-year period, during which you've hit a trial work threshold of earnings. Now, the trial work threshold is below the 1310 substantial gainful activity level, right? So I still haven't updated the numbers. It would be 910 for this year. And so if you accumulate 9 months where you're earning more than $910, that's the 2021 level. Even if those months aren't consecutive, once you've accumulated those 9 months, you are finished with the trial work period. However, that doesn't mean you're finished with your benefits. That's just the first step, right? The second step is a 36 consecutive month period where if you earn more than that higher substantial gainful activity threshold, you don't get your cash payment. If you earn less, you do. So during the trial work time, as you're accumulating those 9 months consecutive or not, you still get your benefit no matter what. During this second period of extended period of eligibility, this 36-month period, you get your benefit if your earnings are below that substantial gainful activity threshold, and you don't get paid if they're above. So it's a 36-month period where it might be off and on or off and on, right? And then, right, If at the end of that time, you're still earning above the substantial gainful activity threshold, then your benefits are stopped. However, there's still a 5-year period where if they drop back down again, you can have expedited reinstatement. So, and then we talked about health benefits for workers with disabilities, which allows people to work and have Medicaid. So I hope with the life planning that we do at Clancy and Associates, and I know with the work that Michael does, and I know the work that the folks at Service Incorporated do too, we all feel, I think, that it's very, very important for our clients or the people we support, right, to work. At the same time, we are critically aware that many of them would not be able to work or even to live without the supports, right? Whether that's the additional cash that they get through the Social Security system, or more importantly, the PAs, the employment supports, the job coaching, everything that they get through the waiver and other Medicaid funded services. So our role with our clients in those situations is to help them navigate, to help them understand all of these very complicated rules, all these different levels, all of these, what happens if I do this, and allow them to make informed choices about how much they work in a way that also allows them to keep the benefits that they need.
Thank you, Alexandra. A few questions came through in the chat and the Q&A during your session. So I'll go ahead and read the ones from the Q&A. You may have covered them, but it wouldn't hurt to probably answer them once again. There was one question that referred to once someone is approved for SSI, is there a wait time to apply for Medicaid?
No. And in fact, it's not necessary to wait until you've been approved for SSI in order to apply for Medicaid. However, we have found in our work that once a person is approved for SSI, it's much easier to get the Medicaid application through. Also, sometimes people have been on Medicaid as a child, and that can continue to 19, and people often want to apply for SSI at 18, but no wait time.
Thank you. From the same person, maybe a little bit of a scenario. Can an 18-year-old student who received SSI and also works, although qualified under student earned income exclusion, earn too much to qualify for Medicaid?
So, okay, if they have SSI and they have Medicaid and those two things are concurrent, then they could earn too much. So then they would fit into that 1619B category. If there is a threshold for that, although it's much higher. So if they then exceeded that threshold, and I could probably try to throw my chart up there, then they could, yes. So you would want to monitor. I don't know if I have easy access to that screen. Yeah. Right. So if the person had SSI and Medicaid as a student, and so the first of all is they're good up to that student earned income exclusion. So because they can earn that much and still maintain their SSI, they would still maintain their Medicaid. If they then went above that, their SSI would get reduced and they could still keep earning until they hit 1619B threshold. And unless they had an individualized situation, so.
Great, thank you. Another one in the chat asks, do ticket to work programs interfere with AHBS through the Medicaid waiver?
Home-based service, are we talking about home-based services? Because the acronym I'm not, the short version is they should not, because they are separate. So ticket to work services are something that you're eligible for because you have a Social Security disability benefit. They should be, it is possible to use them while you're in a waiver funded situation. However, it gets a little bit confusing because Ticket to Work can be provided by DRS or DOORS, and DOORS also has employment programs, and you can't use a DOORS. Some parts of the DOORS employment programs you cannot use while you're in a waiver situation because they're competing funding situations, if that makes sense. I'm not sure I'm explaining that clearly. Maybe one of the ISCs wants to jump in on that. Let Rebecca or Leslie, right? You can't use DOORS employment services and waiver funded employment services, but you could use DOORS employment services probably and Ticket to Work, which might even be coming to you through DOORS.
So you can have DOORS as a grant program at some point in time, if those job coaching services are needed long term, then those services would come out of the waiver for long term. I think I'm explaining that correctly, but you can start with DOORS first, and maybe someone was successful and they don't need long term any longer, and that is therefore not affecting their funding. But later on, if it's needed long term, it would come out of the home base. So it doesn't negate their home base. It doesn't prevent them from having home base. It's just how those funds work may shift over time.
And I should say that Ticket to Work does not provide things like job coaching. It's not hands-on. It's assistance to decide what your skills are, to write a resume, to search for appropriate jobs, to apply for the jobs, to ask your employer for accommodations, to manage your benefits while you're working. But it's not job coaching. It's not job coaching and it's not job placement, if that makes sense.
Gotcha. Thank you.
Yes, thank you very much. I believe there's a question in the chat that may have been posed when you were speaking, Mike. If Mike, you're not the person to answer it, maybe another panelist can. It asks, what is the eligibility for personal assistance in the home through DRS?
I'm sorry, what is the
eligibility for personal assistance in the home through DRS?
I always get this confused, but the person that's hired, they hire their own, they interview and they hire the person that's going to help them. They hire the PA. So I don't know if there's any criteria. I'll have to look that up and see if there is criteria that needs to be met by that PA. Yeah, I'm not sure about that. I'll make a note. And
Great.
is that someone in the chat I can get back to then, in other words?
Yeah, I was going to suggest that the person who asked it, her name is Jenny. Jenny, you have in the chat, if you need it again, I'm certainly happy to put up, but you have Mike's email as well as his phone number. So maybe that would be the best route to get the answer.
Agreed, yes.
Okay. So Jenny, feel free to reach out to Mike separately. One of our team members, Neil, put in the chat that they have to meet determination of need completed by DRS.
Yes, that part is true too. Like the counselor would, the home services counselor would go in there and, like Neil is saying, evaluate them, and that determination of need score determines whether or not they get the PA services. Yep.
Great. Thank you both, Mike and Neil. If anyone has any additional questions, we have a couple minutes left. I just want to thank, Karen's going to wrap up, but thank you each and every panelist for all of the information you shared this evening. There was a lot of information shared. So attendees, if you still have questions, can certainly reach out. If you need to go back and want to review the information again, in a few days, give us maybe 5 business days, we will have the recording of this posted on Ray Graham Association's YouTube channel. So you can certainly share that link with others and review it as frequently as you'd like. There's a few thank yous in the chat as well, everyone. And there is one question about copies of the PowerPoints. I didn't actually ask the presenters that, and I can, if the presenters are willing to share that with me, we can certainly get them out to anybody who's interested. Continued thank yous. All right. Karen, I'm going to go ahead and share our last screens. If you want to do a quick wrap up.
Absolutely. I'm just going to thank our panelists again. I think this was a great evening. So Rebecca, Leslie, Mike, and Alex, we thank you for spending the evening with us and helping our families and everybody that's on the call today to get like important information. We are off for next year. We'll be able to host speaker series in person, but this year today concludes our last speaker series for 2021. And at this point, we'll work on sending people their CEUs. As Sharon stated, if you need any support, any help, anything that was shared here, you need more information on, the contact information is on here. You send it to Sharon, and we'll be able to get back to you. And again, thank you so much for joining us. And until we meet again next year, we are wishing all of you a happy holiday season. So thank you so much.
Thank you, everyone.
Thank you. Take care.